Are you sure she qualifies as an adult?
When it's flashing,
Not a
does that
big
mean
one.
I'm recording?
Yes.
Child
Abuse.
abuse. What does that say?
Child abuse.
Child.
In 2010 alone, 1,537 children died of abuse or neglect. 79.4% were under the age of 4, and 47.7% were under the age of 1. And that is in the U.S. alone, says DoSomething.org. The Child Help website reports that 90% of juvenile sexual abuse victims did know the perpetrator in some way. Did you know that every year 3.3 million reports of child abuse are made in the U.S. involving nearly 6 million children? A report can include multiple children, and the U.S. has the worst record in the industrialized nation, losing 5 children every day to abuse-related death reports. I am going to persuade you how to stop child abuse by discussing with you the types of child abuse, the consequences of child abuse has on the abused child, and how to identify child abuse, and how to stop all types of child abuse. Let's start discussing the different types of child abuse. These are the different types of child abuse and the definitions provided by the U.S. Department of Health and Human Services. Abuse is non-accidental physical injury ranging from minor bruises to severe fractures and death as a result of punching, beating, kicking, biting, shaking, throwing, stabbing, choking, hitting with hands, sticks, or other objects, burning or otherwise harming a child that is inflicted by a parent, caregiver, or other person who has responsibility for the child. Such injuries is considered abuse regardless of whether the caregiver intended to hurt the child. Neglect is the failure of a parent, guardian, or other caregiver to provide for a child's basic needs. Neglect may be physical, failure to provide necessary food or shelter, or lack of appropriate supervision. Medical, failure to provide medical or mental health treatment. Educational, failure to educate a child, attend to special education needs. Emotional, inattention to a child's emotional needs, failure to provide physiological care, or permitting a child to use drugs or alcohol. Sexual abuse includes activities by a parent caregiver such as fondling a child's genitals, penetration, incest, rape, sodomy, indecent exposure, exploitation through prostitution, or the production of pornographic material. Emotional abuse is pattern behavior that impairs a child's emotional development of sense of self-worth, including constant criticism, threats, or rejection, services, as well as withholding love, support, or guidance. Emotional abuse is often difficult to provide, and child protective services may not be able to interfere without evidence of harm or mental injury to child. Emotional abuse is almost always present when other forms of abuse are identified. Abandonment now defines in many states as a form of neglect. In general, a child is considered to be abandoned when the parent identified or whereabouts are unknown. The child has been left alone where the child suffers serious harm or a parent has failed to maintain contact with child provider, reasonable support for a specific period of time. Let's start discussing the different types of child abuse. The different types of child abuse. Now that we have talked about the different types of child abuse, there are definitions. The next is the consequences child abuse has on the abused child. While physical injuries may or not be immediately visible, abuse and neglect have consequences for the children, family, and society last a lifetime, if not generations, says the U.S. Child Department of Human Services and Health. Some of the physical health consequences could be minor as a cut or bruise or scrape, or it could be as severe as death. One of the most common forms of child abuse is abusive head trauma, or most known as shaken baby syndrome. This is when a baby or child is shaken so hard that it causes injury, bleeding of the eyes or brain, damage to the spinal cord and neck, and or rib or bone fractures, says David Newton and Donna Ohlendorf of shaken baby syndrome. The other physical consequences of child abuse is poor physical health like allergies, arthritis, asthma, bronchitis, high blood pressure, and ulcers, or impaired brain development. The immediate emotional effects of child abuse and neglect is isolation, fear, the inability to trust, which can translate into lifelong consequences, including low self-esteem, depression, relationship difficulties, says the U.S. Department of Health and Human Services. In one long-term study, as many as 80% of young adults who had been abused met the diagnostic criteria for at least one psychiatric disorder at the age of 21, said the U.S. Department of Health and Human Services. Other psychological consequences include depression, anxiety, eating disorders, suicide attempts, panic disorders, dissociative disorders, attention deficit hyper disorder, ADHD, anger issues, post-traumatic stress disorder, PTSD, reactive reattachment disorder, cognitive difficulties, including cognitive capacity, language development, and academic achievement, and social difficulties when they grow up. Studies have found abused and neglected children to be at least 25% more likely to experience behavioral problems through the child abuse and neglect statistics. This behavioral consequences in the abused child are delinquency, teen pregnancy, low academic achievement, drug use and abuse, alcohol abuse and use, mental health problems, and engaging in risky behaviors such as sexual and criminal, violent behaviors, smoking cigarettes, and abusive behaviors in relationships with partners and children. That was some insight on the consequences of child abuse has on an abused child, and next is how to identify child abuse. Sometimes how to identify child abuse is hard unless you know exactly what you're looking for. Some of the warning signs of an abused child is being withdrawn, fearful, or anxious about doing something wrong, extremes in behaviors, good or bad, unexplained bruises, cuts, welts,